just say something like, the mayor is running late and should be joining us shortly. Yeah, so just let her know she's going to try to join us late.
Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our COVID-19 news conference for the Amarillo community. Let me go ahead and introduce who's on our panel today. We are joined by Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Amentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. Mayor Ginger Nelson's running a little bit behind due to a previous engagement. We expect her in here briefly. We'll go ahead and open it up to our panel to make some statements, and then we'll take questions from our media who are in attendance. We'll go ahead and start today with Casey Stoughton. Casey, how are you this morning?
I'm great, Dave. Super glad to be here. We just are having a great day at the Public Health Clinic. This is National Public Health Week. And so our team is doing what public health does. We're serving our community with a public health vaccination clinic and contact tracing and childhood and adult immunizations and all of the things that public health does. And we're happy to be here and serving our community during National Public Health Week. I think it's important that a community has a public health department, especially during a time of pandemic. And so if you know a public health employee, it's okay to tell them thank you this week, especially for their service during this pandemic. So happy National Public Health Week. And I also want to say our team. As of yesterday, there were a total of 33,764 cases of COVID-19 in Potter and Randall counties. 17,231 cases in Potter County and 16,531 cases in Randall County. We have a total of 32,824 recoveries, and we are up to 724 deaths here in our community. That leaves us with 214 active cases. The 7-day rolling positivity rate in our community is currently at 4%. And the positivity rate at the drive-through testing site is at 8%. The 5-day new case average is currently at 31 new cases per day, and that's up just a little bit from last week. Yesterday, our GA34 hospitalization percentage was at 2.01%, and that means that 2% or just over 2% of all hospitalized patients have COVID-19. We're currently in status level yellow. The public health drive-through remains operational, and the individuals can call 378-6300 to be screened and directed to the test site. The vaccination clinic is also operational at the Civic Center's entrance 3. Today we will be open until 5 o'clock, and for times on other days and great information about COVID-19, please check out AmarilloAlerts.com. All adults are eligible for the COVID-19 vaccine. We do have the Moderna vaccine at the City of Amarillo Clinic, and so that vaccine is eligible to all adults that are over the age of that are 18 or over. To date, Amarillo Public Health has given 70,250 first doses and 46,044 second doses for a total of 116,294 doses. If you need transportation to either the drive-through testing site or the vaccination clinic, please call Transit at 378-3095. And just a reminder, since we have seen our new case average creep up just a bit from last week, please don't forget your mask, social distancing, hand washing, and vaccination. Remember, if you've had your first dose of the Moderna or the Pfizer vaccine, don't forget your second dose. It's so important that you get that second dose to recognize the full effect of the protection that those vaccines offer. All adults are eligible for the COVID vaccine. So if you have a friend or a neighbor or a family member that hasn't been vaccinated, please bring them to see us. We're happy to offer them their vaccine. And that's all I have today, Dave. Thank you.
Thank you, Casey. Let's now go to Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm good, Dave. Thank you. And good morning, Amarillo. I just want to bring to your attention a couple of points of information some of you have asked me about. How can you see the total amount of vaccines that the city of Amarillo is getting? DSHS reports that on their website with the weekly allocations that they make. So if you're curious about that, or you're wanting a certain type of vaccine, like you want the Johnson & Johnson or you want the Pfizer vaccine, you can see where those doses have been delivered this week in the city. So that's just a point of information for you. And then another point of information, I've had some questions about how the city has spent all of the federal dollars that we received under the CARES Act. How did we distribute those? How did we spend those? And new information is going up today on AmarilloAlerts.com that gives you a summary. It's a graph showing how much we received in the city and where those dollars have gone. So if either of those topics are interesting to you, I just want to pass on information so that you know where to go and get your questions answered. If you have more questions, feel free to call the mayor hotline at 378-6445, or you can always email at publiccommunications@amarillo.gov. So publiccommunications@amarillo.gov. And you can send any question, actually. It doesn't have to just be COVID related, to that email, and we will get you a quick response. So I just want to encourage people to continue getting their vaccines. And it's now probably at the stage where we need to encourage our friends and neighbors. So if you're part of the round of people that have already received their vaccines, then we encourage you to be vocal about it, to talk about your experience and how you responded to the vaccine, and encourage your friends and neighbors, even hold them accountable. Ask more than once in your friendliest voice, but you're doing it out of care and concern for them as individuals and out of care and concern for our entire city. Because the more people that we vaccinate, the safer we will be as a city. And it does affect things. It affects our schools being open. It affects our businesses being open. And we know we want those to be open and to stay open. So I appreciate everyone who has had a vaccine, and just want to encourage every citizen who hasn't to please go and get one. That's all I have this morning, Dave. Thank you.
Thank you, Mayor. Let's now go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you?
Good. Thank you, Dave. I'm in my office here alone. I do have my mask, and as soon as I leave here, I'll be putting it on to just make sure everyone's aware that it's really important when you're out in the community to continue to wear a mask. Briefly, when we look at these numbers, we can see that our new cases remain low, our active cases remain low, our hospitalizations are clearly low. There's plenty of vaccine available. And as the mayor and Casey have mentioned, we'd like to encourage everyone who's eligible to get a vaccine. That's essentially everyone over the age of 18. We also know that the variants are out there. But so far, knock on wood, there's not been any significant impact to our community as measured by active cases, hospitalizations, new cases, et cetera. So that's basically all I have to say this morning, Dave. Everyone get out there and get vaccinated and stay safe.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Hey, morning, Dave. Well, I know what I'm not. I'm not sunburned. That's despite mowing my lawn for the first time last weekend. Can't believe it's already that time of year again. But I say, besides protecting yourself from COVID-19, protect yourself from the West Texas sun. All right. We know that sunscreen saves lives, especially when you're as pale and bald as I am. Now, I wanted to reiterate something I talked about last week. I had another person come to me this week and say, I don't get it. I went to the blood bank and they were going to generously donate blood, and they were told that they did not have COVID-19 antibodies. I said, I don't understand. I've gotten both vaccines. I want to remind people what the blood bank is looking for is they're looking for people who might be able to donate convalescent serum, meaning someone who had the virus now has antibodies they can donate. The antibodies they're looking for are on the inside, basically the core of the virus, which is the nucleocapsid. Those are not the antibodies the vaccines generate. The vaccines generate antibodies against the spike protein on the surface. So if you come to our lab and we look for those spike protein antibodies, we are finding everyone is chock full of antibodies once they get these vaccines. So please don't be alarmed if you go to the blood bank and they say you don't have antibodies. You just don't have the kind of antibodies that the vaccine generates. The state is saying right now, they're not even recommending we test people for the vaccine-related antibodies because everyone's got them who get the vaccine. So with regard to our numbers at Northwest Texas, so we have 209 patients on the acute side of the hospital, only 7 of which have COVID-19, which is great. Okay, we have 33 people in the critical care units. Only 5 of those patients have COVID-19. And we are using 10 ventilators in the hospital right now, only 2 for people who have COVID-19. So numbers continue to look much better. We dropped below double digits for the first time last weekend. So that was a great development. Unfortunately, we've had 1 person die of COVID-19 this month. So that's great in terms of our previous months, but we want to see that to be 0 from now on. Right now, in our outpatient testing, we had 0.8% positive yesterday out of about 110 people tested. So fantastic. We're staying well below 1 to 2% for the most part in terms of our outpatient testing positivity. And right now, we only have 3 employees who are quarantined at the present time. So the numbers continue to look great. So we have sent 72 positive samples for analysis to look for variants. And out of those 72, we have had 2 variants detected. So as Dr. Milton said, they're here. Thankfully, they remain at a very low level, but they are here. Regard to remdesivir, our inpatient medicine, we have 1 patient on treatment right now. We have treated a total of 743 patients with that medication. And then we have the antibodies, the bamlanivimab, the monoclonal antibodies, the outpatient. We've been told that we really should not use that as a single agent anymore because of some of these variants. In fact, we're in the process of ordering the etazivimab, which is the second antibody that we will combine. When we combine the 2, we're affectionately referring to that as BAMIT, which is bamlanivimab and etazivimab. But we will be offering that for people who meet those criteria if they're COVID-19 positive. Lastly, I'd just like to stress what everyone said is please get the vaccine. I've heard a lot of people say, well, I'm not sure about the safety. Please remember, this vaccine is so different from previous ones. This is not a virus that's been disabled that we're injecting into you. This is not a live virus that's been genetically altered that we're injecting into you like we've done in the past. This is a single RNA that gives a single message to our cells to generate 1 protein from that virus, the COVID-19 virus, so our immune systems recognize that. I think this is probably the safest and cleanest vaccine that we have ever seen in its simplicity, but its effectiveness. So I also encourage everyone to continue to encourage your loved ones, neighbors, and all to receive this vaccine. That's all I have today. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Amentier, Chief Medical Officer for BSA. Dr. Amentier, how are you?
Good morning, David. I'm doing well. Thank you. Today, we continue to have a pretty stable number of COVID-19 patients at BSA Hospital. We have a total of 12 inpatients today. Of those 12, 9 are in our intensive care unit. 1 of those patients is on the ventilator. Our numbers have really fluctuated between about 7 to 12 patients per day in the hospital over the past couple of weeks. We'll discharge a few patients and then we'll get a few more admissions coming back. As you can tell from that breakdown I gave you, the predominance of those patients are in the intensive care unit, unfortunately, but fortunately, only 1 is on the ventilator at this time. We are continuing to treat those patients aggressively with the therapies that have the most evidence in terms of helping patients that have severe COVID-19. Steroids, I would say, is at the forefront of that list of drugs. Remdesivir is another drug we will utilize in specific patients. And again, giving them very good supportive care, which our physicians and nurses and our entire staff are providing for those patients. We are continuing to look at ways to improve the experience at BSA for our patients and their families by looking at visitation, looking at what we can do to allow families to be with their loved ones. And we're going to continue to modify those current restrictions as we look at the CDC recommendations and as we look at our incidence of disease in the community. We're seeing low numbers of testing rates here at BSA still. We ended March at 3.2% of all of our tests done, both inpatient and outpatient. Individuals that came here and got tested were positive. That's only 3.2%. remember, is back in November, we had 1 in 3, 33 to 34% of patients were positive at that time with all of our testing. So it's a dramatic reduction, which is good to see. April month to date, we're at about 2.5% of our tests are positive over the first week of the month. So we continue to see that decline in positive testing rates for those folks that are in our community that are coming here to get tested. As Dr. Weiss mentioned, we are modifying what we're doing now with the monoclonal antibody therapy, in that we will not give sole bamlanivimab to patients. We're going to partner that with a second monoclonal antibody, which we have obtained, and we do have now pairing up with the stock of the bamlan that we have. We're also using Regeneron in our facilities where we are able to utilize that drug most easily. A little bit more difficult to administer that in some locations because of the preparation, but that has been an effective drug for us as well. And as Casey mentioned several weeks ago, I think on several instances, we've had very good outcomes with the folks that have been treated with the monoclonal antibodies, which means that very few of those patients have then turned out to require a subsequent hospital admission, which is the whole goal of utilizing those drugs when someone is higher risk and is infected. We are going through the demobilization process with our RAC staff, and again, I think this week we have actually, as of today, the last RAC physician support that we had is here today. We're going to be relying on our employed and our non-employed medical staff members that are in the community to continue to manage our patients, and they're doing a very good job of that. And our nursing staff is going to be probably 100% demobilized in terms of the RAC component by the end of this month. And we're continuing to look at ways to bring in contract nursing as needed to have that backfill. We still have high numbers of overall ICU patients that are non-COVID patients. And again, we're trying to make sure we can maintain our full capacity to manage patients in the community that need inpatient health care. So that's really the gist of my summary today. Happy to answer questions, and thank you for letting me share that data.
Thank you, Dr. Amentier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, David. Thank you. So first of all, let me talk about our COVID numbers, which is, I should make it singular COVID number. We only have one COVID patient in-house, and that person's on our medical surgical ward, so not in our ICU. We continue to vaccinate our veterans. We have about 34% of our veterans that I'm aware of that have been vaccinated throughout our healthcare system. We do offer both the Moderna and the Johnson & Johnson single-dose vaccination here at the Amarillo VA. As with the other panels, I encourage veterans, if you want to be vaccinated, please come here. We will vaccinate you. Probably the biggest change is, as many people have heard, the Save Lives Act has given the VA or facilities the authority to do a wider vaccination. In the past, I could only vaccinate those who were eligible for VA healthcare benefits. Now I can vaccinate any veteran, regardless if they're eligible for healthcare benefits within the VA and regardless of their character of discharge. I can vaccinate spouses of veterans. That includes common law spouses, same-sex spouses, all spouses of veterans I can vaccinate. And that would also include widows or widowers of veterans. And so if there is someone who the veteran has passed away, but their former spouse, we can vaccinate them. I can vaccinate any caregiver of a veteran. Before that, we said that caregiver had to be enrolled in the caregiver support program. But now it's basically anybody that's a caregiver of a veteran. So if you assist a veteran through their activities, that could include assisting with transportation, shopping, assisting with their needs at home. You are a caregiver of a veteran and we can vaccinate you. And so the vaccines that we have available for our veterans are the same ones we would make them. So that would include both the Moderna and the single dose Johnson & Johnson vaccination. If you meet one of those categories and want to be vaccinated, please call to schedule an appointment. Our number is 806-355-9703 and press option 2. Once again, there are many opportunities to get vaccinated, and I encourage everyone in the community to get vaccinated. And so through whatever resources available to you, we encourage you, and we at the VA want to assist in every way we can. With that, I just want to thank our staff for what they do each and every day. And I want to thank the city of Amarillo for this opportunity to talk to my fellow veterans. Thank you, David.
Thank you, Dr. Gonzalez. We'll now go to City Manager Jared Miller. Mr. Miller, how are you today?
Doing good, Dave. Thanks. Just want to remind everyone that the vaccination site over at the city of Amarillo is open, along with a lot of other locations in town where you can get vaccinations. So as Casey was saying earlier, if you want, and the mayor, if you want a specific type of vaccine, if you want to go somewhere other than the city of Amarillo, there's lots of options available for you. I just want to encourage everyone to get that done. If you need to get a vaccination and you want to get a vaccination at the city facility, Amarillo City Transit is providing free transportation to that location. They're also providing free transportation throughout the city. So if you want to go to one of the bus stops near one of the other locations, you can do that too. So if you would like to take advantage of Amarillo City Transit to go to one of the vaccination sites across town, including the city's vaccination site at the Civic Center, please call Amarillo City Transit at 378-3095. That's a great service. Transportation should not be a barrier to getting a vaccination. We're operating currently under the Governor's Executive Order GA34. It's a pretty straightforward executive order. We are all open at 100%. There are no trauma areas in the state that are above 15% hospitalization rate. So the entire state at this point is open at 100%. All residents of Texas are strongly encouraged, using the language from the Governor's Executive Order, to continue to wear face coverings when they can't maintain social distancing. I just want to say how proud I am of our community, where our hospitalization rate was just 2 or 3 months ago. And you compare that, we have all together done a great job. I want to also share that as someone who's gotten a vaccine, and I'm pretty confident most people on this call have already gotten a vaccine as well, there's a lot of comfort and peace that comes from getting that vaccine. We don't think about it until we've gotten it. And I will tell you, for my part, the more of my friends and family that get it, that comfort and peace goes up. So I want to encourage you, for yourself, do it for your friends and family, and you will see what I'm talking about when you feel that comfort and peace that comes from having that vaccine. It enables you to get out and do things with a lot more peace as we open up. That's all I have, Dave.
Thank you, Jared. We'll now go to our media. You're in attendance. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's start with Kevin Welch of News Channel 10. Kevin, how are you today?
I'm good, Dave. Thanks. I guess, Casey, first, have you seen the demographics of people who are being listed as new cases changing? Have they been getting younger?
Not necessarily. I think that they've still remained. We've had, certainly a wide range of people that we have seen that we're working with via contact investigation and contact tracing, and definitely a wide range of people. So I think that means that we all, everybody needs to be vaccinated. Still, that mask wearing is so important because we're all still certainly susceptible.
Right. And at the clinic, have you seen over this, it's been a while now, many allergic reactions?
No. In fact, we haven't had any anaphylactic reactions to the vaccine.
Wow. Dr. Milton, I guess, have you seen any reports of reinfections now that we're a year in?
We have occasionally seen some cases that have been reinfected. I don't think I haven't heard of any recently, but certainly throughout the course of the pandemic, we've had several that have been documented. Yes.
Okay. And I'm not sure who to ask this of exactly, but with the new cases remaining relatively steady and the hospitalization rate going down, does that mean the patients are less severely affected, weaker cases?
Well, I think that certainly the way I look at this is that I'm really pay a close attention to patients that have to be hospitalized and require medical care. And so I think that if you look overall at active cases, I think we maxed out in late November. That was more than 8,000 people in our community that we were actively following that we knew of. Those numbers, I think, Nate, are down less than 200 a week or two ago. We're about 200 now. That's up a little bit. Is that concerning? That's a little bit concerning, but we're not seeing the impact on our hospitals. And so it does imply, at least if you look at those small numbers, that they're not sick enough to where they have to be hospitalized.
Okay. All right, everybody. Thank you.
Thank you, Kevin. Let's now go to KBII Channel 7. I'm not sure who the reporter is, but KBII Channel 7. If you have a question, go right ahead. One more time for KBII Channel 7. You may ask a question, go right ahead. All right, we'll come back here shortly. Let's go to David Gay of the Amarillo Globe News. David, how are you today?
I'm good. Good morning, everybody. I guess my first question, Dr. Weiss, you said that there were 2 variants detected. What specific strain of the variant were they detected for?
So these were not the UK variant. So I think they're more related to maybe the California variants we're seeing, but it was neither UK nor South African, which are the ones that we're kind of watching out for.
And then Dr. Amentier, have you guys do you guys have any updates at BSA regarding cases for the variants?
Yes, my only update is that we have had a couple cases where we have had some folks that were readmitted that had been previously infected and or vaccinated, and were showing evidence of what looked like a reinfection based on our testing and their presentation. So that's a perfect candidate to say, is this a variant or not? Those were sent out to the state laboratories that do that type of testing, and so far we have not confirmed any variant disease. I think we still have a couple cases pending, but again, nothing yet confirmed. It doesn't change my opinion, however, that we know that those variants are out there. We've already seen some, as Dr. Weiss mentioned, in the community with testing at Northwest. I'm certain that we have additional patients with variants here. The question is, if people were vaccinated, is it even translating to clinical disease or not if they were infected? And for those who are not, I think is the most concerning population of patients, meaning if you were not vaccinated and you're getting one of those variant types of virus mutations, if you will, the greatest concern there is that would it translate to a more severe illness, which is why we're stressing so much that it's critical for folks to get vaccinated. Can't stress that enough. You really need to use good rationale when you're deciding about getting your vaccination or not, and make your decision based in science and good judgment, and try to avoid some of the other things that are affecting that decision. Please get vaccinated.
Absolutely. And I guess the last question that I have is, according to reporting by our sister paper down in Lubbock, 0 deaths have been reported, COVID-19 deaths have been reported in Lubbock since March 22nd. And I did some quick math this morning. Since during that same time period, Amarillo has seen an increase of 23 deaths in that time. Is there any, I guess, specific thing that is related to? I know Dr. Weiss has said that there's relatively low numbers of deaths every week. I was just curious if what are these overall deaths being related to, and what, I guess, demographics those are also being related to.
David, I'd just say, we know there's some key risk factors for people having more severe disease, and that in particular, that's people who have diabetes, people who are carrying extra weight, obviously people who are elderly, and even men over women is a risk factor. So, and that list of risk factors continues to grow as the government reports them. I guess one of the things we've seen people presenting fairly late in their course. So by the time they get to the emergency room, they're already have very low oxygen saturations, and so again, sometimes if we can catch these people early, and particularly if they qualify for like the bamlanivimab or one of the monoclonal antibodies, as Dr. Amentier was saying, sometimes we can turn that course pretty quickly. But I think that the ones that we see are getting most sick are the ones who, by the time they make it to the emergency room, a lot of times we're literally intubating them in the emergency room at that point because they already have achieved such illness.
David, I think another observation can be throughout this entire pandemic, we have experienced the growth in cases as well as the recovery 2 weeks to a month after the areas, a number of areas. We've trended behind Lubbock, El Paso, and some other areas in West Texas. I don't know that there's a direct correlation. It does make sense that as we picked up cases shortly after they started picking up cases, we're starting to get down to very low fatality numbers now. And obviously they've been at zero for a number of weeks. So I'm very hopeful, based on what you're telling us, that we'll be able to experience that same zero fatality count for a recurring, an extended period.
Absolutely. That's all the questions I have. Thank you guys so much. Have a good rest of your week.
Thank you, David. Let's now go to Aaron Langston of KMRR Channel 4. Aaron, how are you?
Pretty good. How are y'all?
Good.
First question is, what can y'all say about the lingering effects of people who have had it and recovered? Some of the symptoms they show after recovery, on how long they last, how severe they get, and stuff like that.
Well, I mean, I think that that question can be answered very broadly, and it really depends on a lot of issues. Some people that get hospitalized and are so severely ill, they can develop a chronic lung injury. It's kind of like a fibrosis or a scarring of the lung. And so you have on one side of this end of the spectrum, if they can survive that, they can be what we call like a pulmonary cripple. There are other individuals who have other symptoms that seem to be prolonged, but maybe different in a lot of different ways. Some people lose their sense of smell and they can't seem to get it back. Some people have what's called brain fog, but they never were really so severely ill with a pneumonia that they required hospitalization. So, I think in summary, as we've said before, this virus can affect people in a lot of different ways, and in some ways chronically. And I think a significant number of people can have some chronic symptoms from this. And that's why it's so important to get vaccinated, because the vaccines are so safe and they're proving to be so effective that it just makes all the sense just to get the vaccine and not worry about that kind of issue down the road.
It's a great question. I was watching an article on a Cedars-Sinai now has a post-COVID syndrome clinic. And so they're seeing a lot of these patients coming 6 months after their infection with all kinds of manifestations, Dr. Milton was saying. But there was a great article that came out this week out of the Lancet Psychiatry journal. They looked at over 200,000 post-COVID patients. And what they found is that 1 out of 3 will receive a neurological or psychiatric diagnosis after having the virus. And what it is, they compared that to other respiratory viruses. So they just didn't look at the general population, looked at people that had influenza or other. And if you had COVID-19 versus the flu, you had over a 44% increased chance of having a neurological or psychiatric diagnosis after having COVID versus influenza. So we know it's just, as Dr. Milton said, it's just a plethora of manifestations of these kind of what they call long haul syndrome or post-COVID-19 syndrome at this point.
All righty, thank you very much. And BSA talked about the process there and in the demobilization of the RAC staffing. Where is Northwest on that right now?
We're in the same situation. So the RAC is doing it as a united effort. So we too will also have all our visiting staff demobilized, if not by the end of April, by the first week of May.
All righty. I think that has me covered. Thank you very much.
Thank you, Aaron. We just want to make sure we didn't miss anybody. Let's try it one more time. KBII Channel 7. If you have a question, you may ask it at this time. All right, this concludes our news conference for today. Once again, this is David Henry. I'm the Communications Manager for Amarillo. I want to thank all of our panelists who took the time to provide this information today, and we'll see everybody later. Thank you.
You did.